Hi guys, Nick the Osteo here, and today we're going to be talking a bit about pain for National Pain Week, and we're going to talk about how it can become a little bit more chronic in some people. Now, pain is an output, it's not an input. That's the first thing that we need to understand. So if you were to cut yourself on the finger, your body detects that stimulus, and then it goes up into your brain and it's processed in accordance with the context of what's just gone on, your beliefs around what's just happened and your past experiences. And then descending from the brain down to the finger is the pain response. So pain can either be dampened or amplified depending on the context of what's just gone on and the individual. Now, unfortunately, pain is a part of life, but acute pain actually serves a purpose, whereas chronic pain lasts longer than it should. It lasts longer than the expected tissue healing timeframes, and often it's just debilitating. Now, pain can be likened to hunger. Hunger is a biological driver which causes us to eat when our body needs fuel. And pain causes us to modify our behaviors if we're doing something that could be causing us harm. Now, just as some people overeat and they become overweight, other people can become sensitized and have disproportionate amount of pain for a stimulus which would cause other people's next to none. What this leads to is maladaptive pain responses, such as excessive muscular guarding and avoidance of certain movements, which causes a negative cycle of worsening functioning and more pain. Now, with pain, one thing to realize is that it doesn't always indicate damage, but more that the system can be sensitized. It can be likened to the smoke alarm going off when you boil a kettle. Or if you were to touch an area of your skin that's been sunburned, it's going to be tender and sensitive, but you're not necessarily doing further damage. It's just a tender area and a sensitized area. Now, something which I read recently which really resonated with me in regards to pain is that we often think of our bodies as a machine. Now, if you think of yourself as a machine and you're getting pain, you're starting to think that you're damaging the system or the machine is damaged. And if you imagine driving a car with 3 wheels, it doesn't really paint a very pretty picture in your mind. However, we're not like machines. We actually are living, breathing, adaptable organisms, and we respond positively to physical stress as long as the dosage is adequate and it's not excessive. Now, if you are in persistent pain, what's the solution? Well, a guided treatment plan under the care of a practitioner who can address your predisposing and maintaining factors, such as weakness and dysfunctional movement patterns, in order to retrain the body and the brain to restore optimal functioning. So, if you are suffering from persistent pain, pop into the clinic and we can get you onto the path of optimal health. See ya.